Now we're going to start talking about adaptive immunity. So we've talked about the innate or non-specific. Now we're going to talk about the adaptive or the specific immunity. And then in this PowerPoint, we're going to talk about B cells or B lymphocytes. So the first is the specific or adaptive defenses is what we consider the third line of defense. Remember, we have kind of the barriers are the first line. So things like your skin and the chemicals that it produces, mucous membrane. So the walls is the first line. And then the non-specific cells are going to be the second line, meaning they're still cells, they still fight, but they're non-specific, meaning they don't have to find a match. So these are things like macrophages, the natural killer cells, neutrophils, eosinophils, all of those types. So the adaptive defense, so specific is more efficient than the innate. So it is looking for a specific type of pathogen, and then it will fight against that specific one. The natural killer cells fight against cancer, but we also have T cells or T lymphocytes that we'll talk about the next PowerPoint that do defend against cancer cells as well. So yes, we do get cancer. Yes, it does get missed, but we would have more incidences of cancer without your adaptive immune system. So it's important in fighting just against pathogens from the outside world, but actually threats from inside world of cancer cells with those mutations and the dividing cells that are uncontrollable. So again, the adapted over the specific immunity is T lymphocytes, in which there are three types. So we're going to talk about the three types of that when we get to T cells. And this PowerPoint is going to talk about B cells. So this is saying not present at birth. It's not saying that T cells and B cells are not present at birth. It means that the adaptive immunity needs to learn. So it actually learns as time goes on. This is why we have vaccinations. This is why sometimes having kids exposed to different pathogens, as they're exposed, as they are kind of meeting all these different pathogens in the world, the adaptive or specific immunity learns. And as it learns, the faster and the better it gets. So it's a lifelong learner of trying to understand and continue to fight against the outside world. So specific immunity isn't acquired at birth. We have T cells and we have B cells, but they need to learn about their specific pathogen. So we have two different types of how we get immunity. The most common is going to be exposure to the antigen. Now remember, the antigen is anything that causes immune response. So as we are getting exposed to more and more antigens in the world, especially as kids, then we're having an immune response. And again, we're learning. So this is called active immunity because the immune system actively has to fight against a pathogen. There's also a way we can get immunity that's called passive immunity. And this is where we're receiving antibodies. Now, we're going to learn more about antibodies, but these are produced by plasma cells, which are a derivative of B cells. So they come originally from B cells. So if you kind of skip the reaction, so we'll talk about it, but B cells meet their match. They differentiate into memory cells and plasma cells. Plasma cells then make antibodies. So this is active, where the B cells are reacting, and then plasma cells, and then antibodies. Receiving antibodies or passive immunity, you're skipping this step, you're skipping this step, and you're going to the last step. So your B cells don't have to have a reaction to create plasma cells to create antibodies. You're just skipping to the antibodies. Now, the antibodies, again, are going to help fight against the pathogen. So you still have immunity where you're fighting against it. You just skip the activation phases of the immune system. So we have first active immunity again. So we're going to have an actual reaction. So we're not skipping the steps. We have an activation of either B cells or T cells in this instance, we're talking about B cells. So naturally acquired is you go out into the world, you're exposed to a bacteria, and one of your B cells is fighting against that specific bacteria. And then again, it produces plasma cells and antibodies. So it's natural exposure to antigens in the environment. So, for example, getting the measles virus, and this is not the measles vaccine, this is actually getting the measles. We actually can produce memory as well. So that's another big part of the adaptive or specific immune system, is because we can learn because we remember. So having the measles, you're going to have immunity. You might get sick, you'll have symptoms. But if you are exposed to the measles again, you may not get sick, or you won't get as sick as you did the first time. So we learn and get better. So that's going to be naturally acquired immunity, active immunity. Active immunity artificially. So this means fake. So means it's man-made for the most part. Artificially induced is when you actually give an antigen to someone. So again, make an immune response, because that's what antigens do. So what you're doing is exposing someone to the antigen to cause an active immune response. So this is the major example of vaccination. So what we do is we inject an antigen into someone and use their normal immune system to start learning. So that's why sometimes we need multiple series where your immune system will learn and then it'll learn some more. So it continues to learn. Now, the vaccine, we always say it's either dead, virus or bacteria, or inactivated. So it can't replicate, it can't have its normal activity. So you're not actually giving the condition to someone. So when you get the flu vaccine, it's going to be an activated flu, um, or dead flu vaccine, or virus, and you're going to give that. You can also have antigens that are similar to those pathogens, or stimulated antigens. So some way you're injecting a way for the immune system to have a reaction and to start to learn about this disease that it may not have been exposed to before. So you cause an immune response. That's the point of it. And you produce antibodies against that specific pathogen. So you start being able to be ready to fight against it. And again, also, you're going to have memory cells, which will be important. So memory cells are going to remember it. So if it's exposed to it again naturally, then it will be ready and there'll be a faster response, and you may not even see symptoms. So people say that after they get the a vaccine, they have the disease or they have the condition or symptoms. Well, the symptoms that you're seeing is going to be because your immune system is stimulated. So it's because your immune system is actually being activated. And with vaccines, we are focusing on the specific immunity, but with the dead inactivated pathogens, you're activating your innate or non-specific immunity as well. So you are doing it, but the point is you want memory. So the focus is on your specific immunity, but it's not like they're mutually exclusive. Passive immunity. So now we're looking at things that are passive, where we're skipping the activation of the B cells. So we're skipping the activation of your immune system, skipping the memory part of it. So passive immunity, you're going to have immunity for a certain amount of time, but it may not be, it's not as long as the active immunity, where you actually produce memory cells. So we have two types, naturally acquired. The major one is going to be maternal antibodies. So maternal antibodies can cross the placenta or be in breast milk. So this is important though. From newborns, we showed that they haven't been exposed to pathogens in the world. They're new to the world. So their immune system hasn't learned a lot and doesn't know anything. So what's going to happen is the maternal immune system, the antibodies made by the mom, can pass to the baby through the placenta or the breast milk and be a protective nature. At least gives time before the immune system can start to build and build its own their own antibodies. So this is going to be protective for the newborn while kind of getting used to the new world. We also have artificially induced, so naturally acquired is maternal antibodies from vaccinations, from being exposed prior, spreading that knowledge to the infant until they can have their own kind of immune reaction. Artificially induced, again, is man-made and it's passive, where we're actually giving antibodies to a patient. So we learned a lot or saw this a lot when we were dealing with COVID. So monoclonal antibodies that were given to COVID patients. So what happened is the person was really, really sick and their immune system wasn't doing the best job or was kind of lagging behind fighting off the virus. Then we would give them an infusion or IV antibodies from someone that has already fought off COVID. And so they were antibody specific against COVID, and we'd give it to someone and it would help. So this actually saved people's lives because we could give monoclonal antibodies and this would help their immune system out. So it's kind of actually giving extra guns to an army, so that they can have more weapons to fight against the enemy. So looking again more at adaptive immunity. So again, this is specific. So first time is specificity. T cells and B cells have one match. So they are receptors for a specific antigen. So one B cell or multiple B cells, we're going to fight against one type of antigen. They must find their match. So it's specific. It'll be against a specific strain of the flu virus. So same with T cells. They have to find their specific match. Unlike, again, the non-specific, where anything that they saw as foreign, then they would try to fight against. So the response that we activate for T cells or B cells are also specific. So this is going to be when we talk about B cells. Again, eventually they go to plasma cells and then antibodies. Those antibodies that are produced are specific against the antigen that that B cell initially saw. So say again, using the flu virus, if we have the flu virus in our body, the B cell is going to be able to recognize it and say, oh, hey, that's my guy. That's the one I've been looking for. Well, then again, it differentiates into plasma cells and memory cells. We'll see that. And then it makes an antibody that's going to say, hey, that's my guy too. If there was a different antigen there, then this B cell wouldn't be able to recognize it because this is its match. And these antibodies wouldn't be able to fight against it. It would have to be a different B cell that would recognize this guy. So again, it's specific match, specific antigen. We also have very versatile immune systems. So since there's so many pathogens, so many antigens, then we have millions of lymphocytes that are going to fight against a specific antigen or something that causes an immune response. Once it meets its match, so for the example, this guy met its antigen, then it starts to divide. So again, what happens is they make what we call a clone army. So we're thinking, okay, we don't have um, just one of these antigens, we have many. So we need to make a little clone so we can start fighting against whatever is going to be inside our body. So we start producing more of the same B cells so that we can start looking for that guy. So start searching for more of the flu virus. So it's just building up our clone army. So it's cloned because it's the same specificity that we originally had. I mentioned this a couple of times already. A major property of the adaptive immunity is memory. So, again, this allows us to learn and remember. So, memory is really important. Again, activated lymphocytes, they're going to start to divide. So, you have B cells, they're going to start to divide and more B cells. And then we're also going to have memory cells. So these B cells are going to go and fight off the attack that's happening now. So we're going to have a bunch of B cells that are going to start fighting off the infection that's occurring now. Some of them are going to be memory cells, and they are going to be around for if you have the same antigen exposure later on, it's going to remember it, and you can have a faster, stronger attack that's longer lasting. So just think of it just kind of the same way as studying. So you're learning about this video and this is the first time you've heard it. Well, then if you listen to this video or study some more, you're going to remember a little easier, a little faster, and it may stick with you longer. The more you actually study and the more you actually expose yourself to it, the longer it's going to and the faster you're going to be able to remember it. So just think about things that you've read multiple times over and over and over again. Well, it's a lot easier to remember it when you've read it over and over and over again. So this is the same thing. As you're exposed to the same antigens over and over and over again, the stronger and the better that your immune system is going to react to it. So again, that's a lot of times when we get vaccines where we get multiple in a series is because we're making more memory cells, we're making out a faster, stronger, longer reaction later on if we're exposed to that antigen again. Another thing is tolerance, and that's just saying that your immune system, as long as it's working normal, is going to recognize your cells as you, which isn't important. So if the immune system is supposed to kill cells, that's going to be majority of it. It's going to kill bacteria cells or cancer cells. Then it needs to be able to recognize that your cells are normal, so skin cells are normal, liver cells are normal, and only targeting the ones that are abnormal or kind of foreign, so non-self cells and toxins. So this is going to be recognized as stuff that's not supposed to be there. So your liver cells specific to you are supposed to be there. If there's an abnormal bacteria cell, well, that's not supposed to be there. Or if there's a cancer cell, well, that's abnormal and we need to get rid of it. So it's being able to recognize normal self cells. So we can also get to the point where we have tolerance that we can use to our advantage after kind of the immune system is exposed to an antigen over and over and over and over and over and over again, then eventually it gets to the point where it doesn't have that big of a response to it. And how do we use this? Why would we want this? This is going to be for allergies. If you've heard about allergies and allergic shots, so actually injecting your allergens into you many, many times, then it gets to the point where your immune system just doesn't have that reaction. Because remember, allergies is going to be kind of runny eyes, itchiness, puffy eyes, runny nose, all those symptoms. So it gets to the point where it's kind of like, that's old news. So you still have an immune reaction. You just don't have a significant one that you're feeling all the symptoms that you do for normal kind of allergies. So that's going to be one thing that we use to our advantage.